Libby, the Survivor Network Coordinator at Goshen Center for Cancer Care, and I'm here with providers from our melanoma care team. Welcome. We are here to discuss our team approach to cancer care. Dr. Hardy, what types of skin abnormalities should we be paying attention to?
A good mnemonic with regards to melanoma on things to look for, especially if you're concerned about a particular lesion, is called the A, B, C, D, and E's of melanoma. A stands for asymmetry, meaning that it's, kind of an irregular shaped lesion. B stands for borders, and that the borders are not nice and regular. They may be jagged. C stands for color changes. D stands for diameter, meaning that the lesion has gotten larger over time. And E stands for evolving, meaning that the lesion has just over time undergone significant change. And if you notice a lesion with any of these characteristics, then that's something that I would bring to the attention of either your primary care provider, as well as a dermatologist. It's well documented that the earlier you're able to catch a melanoma, then the greater your chances of survival.
Dr. Agarwal, what are some of the most common types of melanomas that this team addresses?
Yeah, so by and large, the most common melanoma that we see is cutaneous melanoma, so it's skin melanoma. So it's a melanoma that starts somewhere in the skin. There are other far less common types of melanomas, such as ocular melanoma, which can start in the eye, and mucosal melanomas, which start maybe inside the mouth or inside the respiratory tract. However, those are very rare.
How does this team's experience or expertise make a difference to our patients?
At the Goshen Center for Cancer Care, we treat each patient's cancer via a multidisciplinary team approach. And what that entails is bringing together a group of specialists who have different areas of expertise in order to formulate an individualized plan for their cancer. And that's important because each patient and each cancer is different.
So Dr. Moore, how does the team come together to address each case? What does that process look like?
At the Cancer Center, our oncologists are really focused on fighting cancer. We then have an integrative care team, which is focused on helping patients through treatment, with a particular emphasis on quality of life. So this includes oncology-trained dietitians, mind-body counselors, naturopathic doctors, and acupuncturists.
What types of surgical options do we offer for our patients?
So probably the most common type of surgical procedure that's performed for melanomas is something called a wide local excision. And what that entails is removing not only the lesion that has the melanoma, but also a margin of normal tissue. Some patients may also be recommended to undergo something called a sentinel lymph node biopsy. And basically that involves sampling lymph nodes to determine if there's been evidence of spread of melanoma cells to those lymph nodes.
Are there any new treatment or therapy options that we offer to our melanoma patients?
There's an entire new class of medications now called immunotherapy agents. And the way these medications work is that they're trying to activate our immune system to help fight the melanoma. There's another class of medications that are targeted specifically for mutations that we can test for your melanoma. The treatments that we have for melanoma now are far more effective and far less toxic.
What types of integrative support do we have available for our patients with melanoma?
In melanoma, integrative care support might look like ensuring the patient has adequate nutrients to heal from surgery, or using mind-body strategies or counseling to help with reducing fear or anxiety, or possibly even recommending vitamins or other supplements that might help minimize side effects from treatment, whether it's chemotherapy, radiation, or even some of the immunotherapy medications.
Why would you recommend a patient choose Goshen Center for Cancer Care?
We are able to provide patients with the same comprehensive, individualized, high-quality care that they would receive at a larger institution, but with the advantage of it being closer to home. Here we focus on treating the patient as a whole because we understand not only the physical implications of having a diagnosis of cancer, but also the impact that can have on one's spiritual and emotional well-being as well as their family life.
Thank you everyone so much for being here. It's a lot of good information today, so I appreciate that.
Thank you.